Hello, this is Dr. Scott McLean, and this is a YouTube presentation about implant dentistry. This patient had a upper first molar replaced with a dental implant. And you can see the dental implant has a platform shift on top of it, which has kept the bone quite nice over the last 3 months. First, we're going to demonstrate how we're going to do this on a model. So we're going to have an impression coping, and the impression coping is designed to be an internal fitting. You can see the hex on the impression coping plus a little line here. So this is going to be fit on the patient, so we're going to demonstrate this on a model into the hex of the implant. So you have to kind of find the position of the impression coping to fit properly. Once we're satisfied that we have the impression coping in place, we take an x-ray to make sure that the impression coping is seated. We fabricated a custom tray that has an open tray technique access hole. You can see the impression coping goes through, and we want to make sure that the wings of the impression coping are actually inside the impression material when we take this impression, which is critical to making it accurate. In about 2 weeks, a gold adapt crown will be made, and you can see the hex on the end of this, which matches the impression coping. So this can be oriented into the implant, screwed down through the access, so this is a screw retained crown. The nice point about screw retained crowns is they can be taken off later and modified or adjusted or fit, so you have this access hole inside. So here we go. We have a live patient, and we're going to do the impression technique on the patient. We like to use the unigrip driver, and you can attach floss to it. I didn't here, but you should attach floss to it. And we're going to take the healing abutment off of the implant. And this happens to be a 3x5 millimeter flared healing abutment, which is what I want to use to make emergence profile. Ideally, you would never use a 3.6 millimeter, but a 5 or a 6 for a molar would be very appropriate. So try to use a flared type of healing abutment. Now we take a impression coping that's been sterilized, but I still dip it in chlorhexidine just before I'm going to use it in the patient's mouth. So we go to the patient's mouth with this impression coping, trying to line up the hex of the impression coping. We place it into the implant and screw it down. And there's a nice generous thumb screw on this implant system, which allows you to do this quite easily. The impression tray has been fabricated to allow the impression coping to come through the top of the tray. So as we try this in, we want to try this in before we start the procedure. We want to ensure that impression material is going to be completely around the impression coping. I like to take an x-ray to confirm the seating of the impression coping. Look at the bone around this implant, way up over the top of the coping. But here's the line that shows that the impression coping is seated. So we're ready to go for our impression. We're going to dry the impression coping out so the impression coping will be engulfed with the impression material. I use a mono-eject syringe with the tip cut off to inject the Impergum from 3MSP around the impression coping. So we make a generous amount that goes around. Then I'll usually like to place some impression material on the occlusion to make sure I get a nice accurate impression here, particularly the inside of the canine, so I can establish canine guidance for the crown case. Then we'll have a tray that's filled. We don't have to have the palate filled, but we'll put the tray in, making sure that the impression coping screw goes through that hole. You can see it right here. So we want to make sure that that screw is completely through the tray so we can access it later to take the center pin out. Prior to removing the impression, we want to remove the impression material out of the end of the screw. So we can see here that we want to access this, so we have to get this out of the way. And this will allow us to put our unigrip driver into the impression screw and have it kind of fit down in so we don't strip the screw. So here we take out the center pin screw, and we're going to leave the body of the impression coping in the impression itself. If we tug slightly laterally, we can actually pull the impression pin up without even trying to grab it, which is a nice little tip. Here you can see the impression center pin screw, and there's a little gasket on it, and that gasket keeps the pin in the impression coping during kind of carrying it and things like that. But we remove that. Now we're going to remove the tray. So you want to make sure that that pin has been removed before you remove the tray. Now have a look inside. You can see that the body of the impression coping stayed in the impression. So it doesn't move during the impression at all, which is great because we don't want any movement of that impression coping during that procedure. So we'll place the center pin screw back in, and you can see the two go back together. So now the lab can fabricate a beautiful model. So here's the model with a soft tissue kind of development on the model itself. And they'll make a crown and develop that so that it's going to be ready for me to place in the patient's mouth. If we look at the porcelain fused to metal gold adapt crown, we can see that the end has the hex and a conical seal, which is important to maintaining the bone. And this has been proven by meta-analysis to maintain bone around implants. The crestal bone is so critical to maintain for the longevity of the patient's life. We want to have this so that it's going to be lasting a good long time. Once we place the crown, we're going to take an x-ray. I'll do this to confirm the seating before I tighten down the implant crown, and also before I do any kind of occlusal equilibration adjustments. I would suggest you look at the manual from Nobel Biocare for the instructions for use, but you can see a 1 millimeter gap above the screw, and this is how you tell it's seated. Before we get going here to tighten down the implant crown, we'll have a look at the torque driver. The torque driver, when you're tightening down a crown, should only be touched in two spots. Here, on the back of the unigrip driver, and the other spot is on the teardrop aspect of the driver itself, so you can pull here to establish torque. So those are the only two spots when you're tightening down an implant crown that you touch it, and so that way you're going to get a real good calibration when you place it. So here we would be placing an implant screw to 35 newtons. Now another spot that we have to look at is the little arrow. This arrow needs to be facing, when you're tightening down something, the way that the teardrop would be pulled. So we have to turn this so when we pull the teardrop to establish torque, that's going to be in the same direction. You can see the little arrow on the end of it. So this is a critical point because you want to get to 35 newtons like this. Then we have to have that arrow pointing in the right direction. So we'll go to the mouth now. We'll kind of establish the unigrip driver into the tooth and into the screw. And then we're going to start to slowly but surely tighten this down. So we're at 15 newtons there. Coming back, we're going to get to 35 newtons. So we're going to keep going just slowly. We don't want to really be jerking at this thing, but you can see I'm only touching the implant driver in two places. So on that teardrop, I'm not touching the arm of the wrench at all. And that's critical. So here's 35 newtons. You can see my other finger is just holding it into the implant. So those are the only two spots you touch that driver. I like to place some sterile cotton gauze or a piece of retraction cord in the access area, just so that when we're putting the restoration later that we'll be able to get back to the screw if we had to. So we'll put a little bit of cotton, so we sterilize this, and then take it and place it in. So you'll take cotton pliers, carry it to the mouth with the cotton pliers, kind of put it in so it grabs a little bit, and then open the cotton pliers. It's give me a little trouble here. We'll take it, put it in, then open the cotton pliers, and then use one side of the cotton pliers to kind of pack it in there tightly. So I'll usually put a couple in, depending on how high the channel inside the implant crown is. So you put another one in here and then pack it down with just one side of the cotton plier, which acts like a little condenser. We'll check our occlusion, making sure that we don't have a lot of lateral forces on the implant crown. We want to have centric forces, but not lateral. Put a little composite in. Any kind of composite material will work. And pack it down with your PFI, light cure, and then the patient is finished. It's a very easy procedure.
Mike, from my perception, I'm just baffled how easy this was for me.
Yeah.
Like, this is something that, like, my perception beforehand, I was completely skewed. Like, I thought it was going to be like, pain, blood, and awful.
It's crazy, isn't it?
It's crazy how simple this is.
Yeah, that's a
Maybe
good
not so
procedure.
much simple for you, I don't know, but
No, routine.
yeah, wow.
It's very routine.
I'm
Thanks
so
for
grateful. So grateful.